Hi everyone, welcome or welcome back to my YouTube channel once again. My name is Judith, a registered nurse and a medical virtual assistant. And in today's video, I'm going to be doing a hands-on tutorial on medical scribing or medical transcription. Okay, so if you're a medical virtual assistant and you've heard the word medical scribing and you don't really know how it works in a real clinic setting, then this video is for you, because in this video, I'm going to be walking you through how you do medical scribing in a real clinic setting. Okay, so I'm not going to give you a theory or a textbook definition on what this medical scribing is all about. I'm going to walk you through using the DrChrono EHR, okay, so that you would understand it better. This tutorial is for medical virtual assistants or beginner medical virtual assistants who are trying to learn medical scribing. I want to tell you that you are learning it in the right way by watching this video. And also this video is for anyone working with the US health clinics and just wants to know how medical scribing works in real clinic setting. It's also for anyone who is tired of theories and just wants to learn something more practical. Okay. So yes, so before we start, let me give you an overview of what medical scribing and medical transcription is all about. So medical scribing is simply documenting the provider's encounter with the patient in the clinic's EHR system in real time or shortly after. Okay. So if you're in the medical line, it simply means history taking. Okay. You know, when a patient comes to the hospital or a clinic or is admitted into your ward, there is a template to follow in order to record take history for that patient. Yes, this is just basically what it means. The only difference is that you are not the one asking the patient's questions. You are only taking notes. Your provider is the one asking the questions, while you only have to take notes of what the provider says and what the patient says and does. Okay. Also, what the provider measures. Okay. So you just take notes. That is your job. So now some clinics, they want live documentation. This is known as medical scribing. Like I said earlier, you do this while the visit is happening or just shortly after, while some allow delayed documentation like days after the encounter. This is known as medical transcription. Most times as a medical virtual assistant, you find yourself in the second phase, which is medical transcription, but this is not always the case. It depends on the clinic you work for. So in medical transcription, you use the recordings from the visit to transcribe into medical notes. Okay. Now let's see how this medical scribing works in a real clinic. Okay. Now, as you can see on my screen, this patient Smith demo. Okay, this is a mock patient, and if I already made a video on how you can access the free trial accounts of the DrChrono EHR. So if you've not seen the video, you do well to see it so I can be able to practice. Okay, because you only learn by doing. So now this patients, let's say this patient has checked in. So when you click on this patient now, this appointment, you're going to come here on the status. You click here on the status and you're going to select checked in. Okay. Now for medical scribing, you're going to click on view clinical notes. So now you're going to see this H&P. You're going to see SOAP additional notes. Okay. So you're going to click on this SOAP notes because this is what concerns you as a medical virtual assistant. This is what most clinics use, although they have other forms of medical documentation formats like DAP notes and the rest of them. Okay. So once you click on this SOAP notes, as you can see, DrChrono already like has a template on this. There is shift complaints, there is HPI, social history, family history. Okay, so I want to explain to you what this subjective means. So subjective notes is whatever you hear the patient say, everything that the patient says from the complaints, the history, yeah, whatever question that is being asked to the patient and the patient response or what the patient says on their own, this is where you record it. So anything coming from the patients, you record it here on the subjective notes. Okay. Now the objective notes involves what the provider measures or observes. Okay, so you, as you can see, you have general within normal limits, the comments, the HEENT within normal limits, skin comments within normal limits. So whatever you hear the provider, whatever you see the provider measure, observe, notes, this is where you record it. This is coming from the provider. Now assessment is the provider's clinical judgment. Okay, this is where you include the ICD-10 codes, the ICD-10 codes, okay? That's more like the diagnosis. So, after a provider has seen a patient, the provider says, oh, this is wrong with this is what is wrong with this patient. So this is where you include the ICD-10 code. So here you only include this if you are very sure, if the provider is very sure, you don't guess, okay? So this is where you include it. And then we have plan. Plan is more like whatever that was the provider said that will be done for these patients, let's say medications, lab, radiology, whatever, like anything that would be done for the patients, like because of that visit, a blood work or whatever. This is where you document it. Okay. Now we have medications and allergies. So any allergy or medication allergy the patient has, this is the area for it. And then we have billing. When you include the ICD-10 codes, the CPT codes, and the rest of them, this is what helps in creating a claim for these patients. Okay. Now, after you've documented all of this, you can click on this preview notes here and view the SOAP notes or the documentation. So now let's get started. So now I'm going to play an audio, okay? So this recording, we are going to use the recordings to fill up, to do this SOAP documentation, okay? So I also want to tell you that this audio is imperfect and is AI generated, okay, and is not real. So in real time, it could be faster, it could be more practical, okay?
Good morning, Mr. Smith. How are you feeling today?
Morning, doctor. Honestly, I've been feeling a bit off lately. I've had a cough and some fatigue for about a week now.
I see. Let's start with your symptoms. The cough, would you say it's dry or productive? Any fever or chills?
It's mostly dry, but occasionally I cough up a little mucus. No fever, but I felt tired and sometimes short of breath after climbing stairs.
Okay, thank you. Any chest pain, wheezing, or night sweats?
No chest pain or night sweats. Just the shortness of breath I mentioned.
Got it. How about your medical history? Any chronic conditions, allergies, or medications?
No chronic illnesses. I take a multivitamin daily. I'm not allergic to anything I know of.
That's helpful. Do you smoke or drink alcohol?
I quit smoking 5 years ago. I occasionally have a drink socially.
Great. I'd like to listen to your lungs and take your temperature, blood pressure, and oxygen levels. Your vitals look normal, and your lungs sound a bit congested, but there's no wheezing. It could be a mild respiratory infection.
Should I be worried about COVID or pneumonia?
It's unlikely severe, but we'll do a rapid COVID test and may order a chest x-ray just to be safe. In the meantime, rest, stay hydrated, and I can prescribe something to help with the cough.
Okay, doctor.
Do you have any questions about your symptoms or care?
No, that covers it. Thank you.
You're welcome. Mr. Smith, we'll follow up in a few days once the tests come back. And if your symptoms worsen, please come in immediately. I will.
Thanks again.
Take care and get some rest.
Okay, so now we are done. Okay, so as you can see, the chief complaints is cough and fatigue for 1 week. We have the history of present illness, the social history. These things are what the patient says as the provider is asking, the patient is responding. So these were the comments the patients made. So no need adding nothing reported here for all of this. We just have for the sake of being fast, you just have to go ahead and record the areas the patients commented on. And if you don't see any templates of anything that the patient commented on here, you can come here on notes and add it here, okay? On the objective, on what was observed. So as you can see, patients alert in no acute distress. So I said you are both documenting with your eyes and with your ear. You are noting with your eyes and with your ears. So cardiovascular within normal limits. So anything that was the templates, you don't see it here, you come here and write it, okay? And then we have the assessments, okay? So if you notice here, I did not put any codes. I did not assign any codes for these patients. Okay, the reason is because when the provider and the patient they were talking, and the provider only said this could be a mild respiratory infection. And if you come here to ICD-10, if you come here to search for this code, you're not going to see any code for mild respiratory infection. Like I said, you are not supposed to guess. Okay, you may know that okay, this is upper respiratory infection, but you are not supposed to guess. It's not your job. You are not meant to like do this. So later you can use the provider's notes to fill up this area. You can use the provider's notes or after the test, because you know tests were ordered for this patient. So the diagnosis is not definitive now. So you can always do this later, okay? Because this note is already saved. And then this is the plan, okay? So lab was ordered for this patient's rapid COVID test was ordered, chest X-ray to be considered if symptoms persist. So whatever you hear the provider say that will be done for these patients, you do it. Home health, the patient was encouraged on rest and increased oral fluids. So just like it was said. So anything you did not see here, you write it under here. Patient's education, follow up in few days to review test results. Okay. Now we have medication allergy. Okay, here I wrote no non-drug allergies, no non-drug allergies because the patient says they don't have any non-drug allergies. Okay, so now I know that we added no non-drug allergies here, but let's say suppose the patient has a drug allergy. Okay, you're going to click here on allergy. Okay, and you're going to click here plus on this plus sign here. You're going to add the allergy. Let's say it's a specific drug allergy. You click on it. Let's say is a penicillin allergy, whatever drug the patient is has allergy on, you're going to select the medication, okay, the severity, the reaction, the reaction the patient has whenever they take the medication, the severity, okay, and then any notes here, and then you're going to save it. So this is how you record an allergy for the patient. Okay, you don't have to go to the patient's chart and start going through that long route. So also, let's say you want to record a medication for these patients, you're going to also click here and add whatever medication that you want to add for these patients here, okay? So, but then this patient has no known drug allergy, okay? And then billing, for this claim to be created, you need to put an ICD-10 code, and we have not assigned an ICD-10 code for this visit, for this encounter, okay? So this is basically how you record, you draft an SOAP note for a patient, okay? I also want to let you know that in as much as we used an AI generated video to practice this, you can search on YouTube on mock provider encounter with the patients and use something that is more practical to practice your medical scribing or medical transcription, okay? And if you're able to get something to on this to add on your portfolio, that will really be a big plus for you. So now the truth is that most clinics they allow some AI powered HIPAA compliant tools to help them in doing this. So you don't have to like do it on your own from the beginning. Like I said earlier, medical scribing, you are doing it in real time. You can click here and preview the SOAP notes that you have created, okay? Now you can see these patients, every information about these patients. Of course, this information will be reviewed, okay? If you're going to get a hands-on practical like this and add to your portfolio, that will really be good. That will really be great, okay? So and I think you should do that. You should practice this and do that. If you found this video very helpful, please give it a thumbs up. Subscribe to my YouTube channel, turn on your notification bell so I don't miss any MedVA contents from this channel. And please drop your questions in the comment section below as I would try to answer every single one of them. And thank you for watching. See you in my next one. Bye.